Thank you for joining us for another COVID-19 video update. I'm Joy Jensen. I work with the vaccine team and Latinx outreach for the Whatcom County Health Department. The case rate leveled off last month. There were 633 confirmed and probable cases, with an average daily case count of 20 cases. The 7-day average rate for the overall month of March was 62.7 cases per 100,000 people in Whatcom County. This is an 84% decrease from February. March hospitalization rates decreased as well. We saw a total of 37 COVID-19 hospitalizations, and the 7-day average decreased from roughly 14 hospitalizations per week to about 3, or a decline of 81%. We also saw a significant drop in COVID-19 hospitalizations among individuals 65 and older during the month of March. Individuals 50 and older with a booster dose of COVID-19 vaccine were hospitalized in far fewer numbers than either unvaccinated or fully vaccinated individuals. Whatcom County deaths due to COVID-19 also significantly declined last month. As of April 15th, Whatcom County recorded just 2 COVID-19 deaths based on specimens gathered in March, both over the age of 80. To put that number into perspective, in January, there were 49 COVID-19 deaths recorded. In February, this number fell to 15. We've made changes to the county data dashboard to include case, hospitalizations, and death cumulative counts by month and year and rates by vaccination status. The dashboard will be updated every Thursday and will display data through the previous Saturday. We've included a link in the video description. If you'd like to read the complete data report, review the state and county data dashboards, visit whatcomcounty.us/COVID data. Getting vaccinated, whether it's your first dose or your first or second booster, is the best way to prevent COVID case spikes in Whatcom County. Get tested if you've been exposed to someone with COVID-19 and stay home if you're sick to avoid spreading the virus. As of March 30th, the Washington Department of Health's booster dose recommendations are as follows. Everyone 12 and older should receive a booster dose 5 months after completing their 2-dose vaccine series of Pfizer or Moderna, or 2 months after receiving the single-shot Johnson & Johnson vaccine. Everyone 50 and older can receive a second booster dose 4 months after receiving their first booster dose. Individuals 12 and older who are moderately or severely immunocompromised can receive a second booster dose 4 months after receiving their first booster dose. Those 18 and older who received a primary vaccine and booster dose of the J&J vaccine 4 months ago can receive a second booster dose of an mRNA COVID-19 vaccine. If you are seeking a booster or even your first dose, you can make an appointment at www.vaccinelocator.doh.wa.gov or check our website whatcomcounty.us/COVID for pop-up clinics near you. Home test kits are available at no cost to you. You can order yours by visiting sayyescovidhometest.org or covidtest.gov. Whatcom County also has a limited number of take-home COVID test kits available at our pop-up clinics while supplies last. Unfortunately, the results from these home tests remain largely underreported, which affects contact tracing and data collection efforts. If you use an at-home test, you can report your positive result to Washington's COVID-19 hotline at 1-800-525-0127. This supports our effort to track outbreaks and prevents the disease from further spreading in our communities. If you have any more questions about vaccinations, testing, data, isolation, and quarantine, or anything else related to COVID-19, you can find answers at whatcomcounty.us/COVID. Thanks for watching. We'll see you next time.